Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I want to continue my cancer series and talk about the most common types of cancer and their warning signs. Did you know there are over 100 different types of cancer, yet only a handful account for up to 75% of all diagnosed cases? Here's a list of the most common types of cancer in no particular order, along with their early warning signs and risk factors. Protect yourself and those you love by being aware of the symptoms so the disease can be caught and treated in the early stages. Number 1, Nonhodgkins lymphoma. Nonhodgkins lymphoma is not just one disease, but rather a set of diseases involving the lymphocytes, or white blood cells, within the lymphatic system. Lymphatic organs include the lymph nodes, bone marrow, thymus gland, and spleen. Symptoms of this type of cancer include swelling of the lymph nodes in the neck, groin, and armpits, fever, losing weight without trying, night sweats, shortness of breath, fatigue, and itchy skin. Risk factors include gender, males are at a higher risk, infections such as H. pylori and Epstein-Barr, impaired immune function, and age, with certain types occurring more commonly in young adults and other types occurring more frequently in those over 55. Number 2, leukemia. Leukemia is a group of blood cancers that initiate in the bone marrow. There are 4 types of leukemia, including 2 chronic types and 2 acute types: chronic lymphocytic and chronic myeloid leukemia, and acute lymphoblastic and acute myeloid leukemia. Symptoms include persistent fatigue, weight loss, swollen lymph nodes, easy bruising and bleeding, bone pain, night sweats, enlarged spleen or liver, fever, increased risk of infections, and frequent nosebleeds. Associated risk factors include a family history of leukemia, inherited immune system conditions, exposure to chemotherapy, radiation, and chemicals such as benzene, smoking and alcohol consumption, excessive sun exposure, obesity, and genetic syndromes such as Down syndrome. Number 3, pancreatic cancer. Pancreatic cancer is a particularly deadly type of cancer that often remains undetected until the disease is in the advanced stages. In the beginning stages, pancreatic cancer is painless, with symptoms becoming noticeable once the cancer has become metastatic, and this makes it difficult to treat. Symptoms include a dull ache in the abdomen, bloating, pain in the back, nausea and vomiting, and jaundice. Risk factors that increase the chances of developing pancreatic cancer include age. Risk goes up with advancing age. Ethnicity. African Americans and Ashkenazi Jews are at a higher risk. Smoking. A diet rich in fatty food. A family history of pancreatic cancer. Diabetes, and gender, with more men being diagnosed with the disease than women. Number 4, colorectal cancer. Cancer of the colon, or large intestine, is one of the most common types of cancer in both men and women. It has a good prognosis if diagnosed and treated in the early stages. Early warning signs to be aware of include jaundice, pain in the abdomen, cramping and bloating, blood in the stool, rectal bleeding, consistent fatigue, diarrhea and constipation, and weight loss. Risk factors include obesity, a family history of colorectal cancer, a sedentary lifestyle, a diet high in processed meat, regular alcohol consumption, and age, with the majority of colon cancers occurring after age 50. It can, however, occur in younger people, including teenagers. Number 5, lung cancer. There are 2 primary categories of lung cancer: non-small cell and small cell. Non-small cell lung cancer is the most common form and accounts for up to 85% of all cases. Sadly, over half of all cases are already in the advanced stages. Symptoms include shortness of breath, difficulty swallowing, wheezing and hoarseness, chronic cough, coughing up blood, pain, which would be in the advanced stages, and recurrent infections such as pneumonia and bronchitis. Risk factors include smoking, exposure to secondhand smoke, age, with older people being at higher risk, exposure to radon gas, asbestos, radiation, and other carcinogenic compounds, a family history of lung cancer, genetics, and pollution. Number 6, breast cancer. There are 2 types of breast cancer, non-invasive and invasive, with the latter type potentially being life-threatening. Infiltrating ductal carcinoma and infiltrating lobular carcinoma are the 2 main types of invasive breast cancer. There are different receptor types that determine treatment, and these are estrogen receptor positive, estrogen receptor negative, progesterone receptor positive, HER2 positive, and triple negative. Signs to look for include changes in breast size or shape, nipple discharge or inversion, persistent pain in one area, discoloration, scaly patches of skin, redness or swelling, darkening of the breast, areas of warmth, and skin dimpling or puckering. The chances of developing breast cancer increases with the following risk factors: obesity, a sedentary lifestyle, gender, obviously females are at higher risk, smoking and alcohol consumption, exposure to ionizing radiation, a family history of breast cancer, never having breastfed a baby, menstruation beginning before age 12, never becoming pregnant, bearing a child at an older age, and having a caretaking personality. Number 7, cervical cancer. Most cervical cancers are caused by the HPV or human papillomavirus. HPV is common and can be transmitted during sex. The virus doesn't cause any symptoms, and the majority of the time will resolve on its own. However, it may affect cervical changes that over time can become cancerous. Symptoms include irregular bleeding, abnormal discharge, and bleeding after intercourse. Risk factors that increase the chances of developing cervical cancer include smoking, impaired immunity, prolonged birth control use over 5 years, multiple sexual partners, and having 3 or more pregnancies. Regular pap smears can reduce your risk. Number 8, prostate cancer. Prostate cancer is the most common cancer in men, particularly men over age 65. Fortunately, it is rare in men under 40 and many times is slow growing and confined to the gland itself. Other types can be more aggressive, spreading beyond the prostate, which can be successfully treated if detected early. The prostate sits below the bladder, which explains symptoms such as difficulty urinating. Symptoms include low back pain, pelvic pain or discomfort, difficulty passing urine, painful ejaculation, bone pain, erectile dysfunction, and blood in the semen. Risk factors for prostate cancer include age, a family history of the disease, obesity, and race, with African Americans being at greater risk of developing the aggressive form of prostate cancer. Benign prostatic hyperplasia, or BPH, bacterial prostatitis, chronic inflammation of the prostate, and acute or chronic infections also play into risk. Prostate cancer is the 3rd leading cause of death in men in the U.S., following colon and lung cancer. Number 9, bladder cancer. The most common type of bladder cancer develops in the urothelial cells that line the bladder. If diagnosed before it has spread, bladder cancer can be effectively treated. Symptoms include blood in the urine, urinary urgency and frequency, an inability to urinate, painful urination, pain in the pelvic region, urinary tract infections, unexplained fatigue, and weight loss. The risk of developing bladder cancer can be up to 7 times higher if a person smokes cigarettes, pipes, or cigars. Exposure to carcinogenic chemicals, particularly arsenic, also increases risk, as do chronic bladder problems such as infections and stones, and age, with up to 70% of those with bladder cancer being over 65. Caucasians are twice as likely to be diagnosed with this type of cancer, as are African Americans, yet the latter group are twice as likely to die of the disease. Squamous cell bladder cancer is associated with the parasitic infection schistosomiasis. Number 10, esophageal cancer. Esophageal cancer develops in the inner layer of the esophagus, the tube which connects the throat to the stomach. Adenocarcinoma and squamous cell carcinoma are the two main types of esophageal cancer. In the initial stages of the disease, there may be an absence of symptoms. Symptoms arise as the cancer progresses, including coughing and hoarseness, heartburn, indigestion, pain behind the breastbone, difficulty swallowing, and unexplained weight loss. Risk factors include tobacco and alcohol use, smoking, GERD, and Barrett's esophagus, which is a complication of GERD. And this increases the chances of developing esophageal adenocarcinoma. Early detection of Barrett's esophagus is crucial to reduce cancer risk. Number 11, liver cancer. Hepatocellular carcinoma, HCC, or liver cancer, is the most common cancer worldwide, with the primary risk factor being chronic hepatitis, which is a viral infection of the liver. Both hepatitis and cirrhosis, or scarring of the liver, increase the odds of developing liver cancer. This risk significantly increases with heavy alcohol use. Symptoms include fatigue, swelling of the abdomen, appetite suppression, unexplained weight loss, weakness, vomiting and nausea, jaundice, and white chalky stools. Risk factors for liver cancer include non-alcoholic fatty liver disease, excessive alcohol use, diabetes, aflatoxin exposure, and chronic infections such as hepatitis B and hepatitis C, which lead to liver cirrhosis. Liver cancer is more common in men than women, but this may be due to behaviors that increase risk. A subtype of liver cancer called fibrolamellar is more common in women. Asian Americans and Pacific Islanders are at the highest risk in the U.S. Risk increases with age, with those over 50 being the most likely to develop the disease. And our last one, number 12, stomach cancer. Stomach cancer commonly starts in the mucus-producing cells that line the stomach. Signs that signal the presence of cancer may not be apparent in the initial stages, with symptoms being mistaken for the flu. And because of this, the cancer may not be detected until it's advanced and aggressive. Symptoms include pain in the stomach, severe heartburn, indigestion, bloating, nausea and vomiting, a feeling of fullness after eating, and weight loss. Gastric adenocarcinoma accounts for up to 95% of all cases of stomach cancer. There are two types, intestinal type, which is found in the lower areas of the stomach, and diffuse type, an aggressive form of stomach cancer. Risk factors include obesity, smoking, gender, with more men getting it, chemical exposure, having an A blood type, stomach surgery, and poor dietary habits such as eating smoked and preserved foods. Gastric polyps, pernicious anemia, and atrophic gastritis also increase risk. In summary, knowing the signs and symptoms of the most common types of cancer is important for reducing your risk. Treatment success is much better when the disease is diagnosed in the early stages, while the prognosis is still favorable. If you experience any new symptoms, get them checked out as soon as possible. Did you know these types of cancer were the most common? Let me know in the comment section. Thanks so much for watching.